Welcome back. Thursday Newsday. The Health Minister, Motsoaledi, is in the Northwest Province for a second time this week. You'll know that a Nahawu strike has in many respects crippled health services in the province. 73 doctors have written to health officials calling for urgent action. The South African Military Health Service has in the meantime been called in to help. Let's bring you up to date with the very latest on developments in the Northwest. Samkele Maseko, good afternoon to you in Mahikeng. So what is the Health Minister hoping to achieve this time around that he was unable to do on a previous visit?
Well, Jeremy, the minister speaking to our colleague Uveka during the week, he said that he's coming back here today to get a report on how far the contingency plan that they've put place with the assistance of the Military Health Service, who have also been assisting the provincial government, how far that has come. And he was also seeking to extend that to other clinics and other hospitals in the province. He's probably coming to get an update on that, but we don't know whether he's arrived in the province as yet, because we spoke to his spokesperson, Popo, yesterday evening, who did confirm that the minister would be here at around 1 o'clock, but he's not come to the Mahikeng hospital as yet. They would be meeting in another venue, but there is a twist to this now. The Minister of Communications, Nomvula Mokonyane, announced the interministerial team that will be coming to the province, that will be led by Mayor Dr. Nkosazana Dlamini Zuma, the minister in the presidency, on a fact-finding mission for the next 2 weeks on what's truly going on in the province. You'd understand that basically the Treasury in the province, along with the Department of Health, have been placed under administration after the cabinet meeting that took place yesterday in Cape Town.
We know that military doctors have been drafted in. Are they able to plug the gap at the moment? In other words, are health services being delivered as a result of this intervention?
Well, Jeremy, as we've come to know, and from the response of the minister, he did describe this situation of the health department in the province, specifically relating to the hospitals and the provision of services to the people, such as medicines, ARV drugs, TB drugs. It's basically a crisis. He says it's a crisis, and that they are hoping that these medication and patients could receive medication in the province. He's hoping that this intervention of the military service will assist them in the long run. But you'd also understand that they themselves have a stretched number of resources, so there will always be those shortfalls. But the only time we will definitely know if the intervention is yielding any positive results and positive fruits is when we get a detailed report from the minister himself, Motsoaledi, whom we seemingly can't get a hold of right now, because his spokesperson is just simply not answering his phone, not answering calls, not answering text messages. He's just reading them and not doing anything. So we've been trying to get a hold of them the whole day, and it's been to no avail, basically. So we haven't yet gotten a full report about the intervention the minister has come to, and done in the province, and the report he's seeking to gain today. But he has described the situation in the province as being in a dire situation, and is basically a crisis.
What is Nahawu telling you in this respect, the union?
The union's Kaya Kaba did speak a few weeks back, saying that they've been in negotiations and the strike has been ongoing since February. The premier of the province did say that an amount was paid to the workers at some point in time, and then the strike is still pursuing. Nahawu has not been that vocal on the issue as yet. I'm yet again to get a hold of the spokesperson of Nahawu, Kaya Kaba. I'll be going back to him and asking him where are they with their strike and how far are they willing to go, because there have been accusations that Nahawu is blocking patients from accessing hospitals and preventing doctors and nurses from providing medication. Some medical practitioners have even been scared and basically threatened and not to go to their workplaces. These are the reports that are coming out, in which Nahawu has vehemently and basically denied and said they've got nothing to do with this. Their members are not participating in any intimidation of patients and medical practitioners in the province.
And Samkele, just finally, I would imagine that those patients that you've had an opportunity to talk to remain increasingly frustrated, and probably there is a growing degree of concern here.
Well, Jeremy, it's not just patients overall in the Northwest that have impatience and they are basically scared. Many people, for instance, yesterday we were passing by Vryburg. All the shops were closed in Vryburg. It was just one restaurant that was open. So basically there is some sense of fear in the province politically and economically, because some towns have basically shut down all their economic bases. You remember those protests in Klerksdorp yesterday where shops were basically looted. About 100 people have already been arrested in the province for violent protests and for looting. So there is that sense of fear ongoing currently in the province. Earlier on, the Premier did release a statement calling for calm in the province.
All right, we'll check in with you a little bit later. Samkeli Maseko in Mahikeng, thank you very much.